Namaskar. Welcome to my YouTube channel. Today we are going to solve Btsc Radiographer X-Ray Technician 2025 question paper. Let's start. The first question. Which of the following is a U-shaped bone in the neck? Option A. Pisiform bone. Option B. Ischium bone. Option C. Hyoid bone. Option D. Malleus bone. The correct option is option C. Hyoid bone. Which is the primary reflex center for vital functions like breathing, heart rate regulation, and blood pressure control? Option A. Medulla oblongata. Option B. Cerebrum. Option C. Hypothalamus. Option D. Cerebellum. The correct option is option A. Medulla oblongata. Which of the following structures regulates body temperature, hunger, and sleep? Option A. Metathalamus. Option B. Hypothalamus. Option C. Epithalamus. Option D. Thalamus. The correct option is option B. Hypothalamus. Which is a proteolytic enzyme? Option A. Trypsin. Option B. Lactase. Option C. Amylase. Option D. Sucrose. The correct option is option A. Trypsin. Which of the following statements is true about the posterior anterior view of chest X-ray? Option A. The X-ray beam passes from one side of the body to the other. Option B. The X-ray beam is taken at an angle used to better visualized joint. Option C. The X-ray beam passes from the front to the back of the body. Option D. The X-ray beam passes from the back to the front of the body. The correct option is option D. The X-ray beam passes from the back to the front of the body. Which of the following is the primary muscle of respiration? Option A. Pterygoid. Option B. Scalene. Option C. Diaphragm. Option D. Trapezius. The correct option is option C. Diaphragm. Fluid accumulation in the abdomen detected in the X-ray abdomen is suggestive of option A. Ascites. Option B. Cardiac tamponade. Option C. Pleural effusion. Option D. Pneumoperitoneum. The correct option is option A. Ascites. Which of the following cranial nerve is mainly responsible for hearing and balance? Option A. Oculomotor nerve. Option B. Abducens nerve. Option C. Accessory nerve. Option D. Acoustic nerve. The correct option is option D. Acoustic nerve. All of the following are the naturally occurring radionuclides found in the environment except option A. Uranium. Option B. Technetium. Option C. Radium. Option D. Radon. The correct option is option B. Technetium. Where is Broca's area situated in the brain? Option A. Parietal lobe. Option B. Temporal lobe. Option C. Occipital lobe. Option D. Frontal lobe. The correct option is option D. Frontal lobe. Ampere is the unit of which of the following parameters? Option A. Light intensity. Option B. Resistance. Option C. Voltage. Option D. Electric current. The correct option is option D. Electric current. Which is a type of radiation therapy that involves placing radioactive material inside or near a cancerous tumor? Option A. Acupressure. Option B. Brachytherapy. Option C. Acupuncture. Option D. Teletherapy. The correct option is option B. Brachytherapy. What is the product of bombarding aluminium-27 with alpha particles? Option A. Sodium-12. Option B. Potassium-41. Option C. Phosphorus-30. Option D. Calcium-22. The correct option is option C. Phosphorus-30. All of the following structures are best visualized by a barium mill except option A. Duodenum. Option B. Colon. Option C. Stomach. Option D. Esophagus. The correct option is option B. Colon. What is DC in electricity? Option A. Doped current. Option B. Deviational current. Option C. Direct current. Option D. Diagonal current. The correct option is option C. Direct current. Smooth muscle is found in all of the following organs except option A, stomach, option B, heart, option C, bladder, option D, intestine. The correct option is option B, heart. Brimstone is also known as option A, freezing radiation, option B, joining radiation, option C, breaking radiation, option D, combining radiation. The correct option is option C, breaking radiation. 5-hydroxytryptamine is the chemical name of which of the following neurotransmitters? Option A, dopamine, option B, glutamine, option C, serotonin, option D, histidine. The correct option is option C, serotonin. Which of the following lobes of the cerebral cortex process the visual information from the eyes? Option A, frontal lobe, option B, temporal lobe, option C, parietal lobe, option D, occipital lobe. The correct option is option D, occipital lobe. The primary SI unit for measuring pressure is option A, Newton, option B, candela, option C, lux, option D, Pascal. The correct option is option D, Pascal. What is the wavelength of X-rays? Option A, 10 to 100 nanometers, option B, 100 to 1000 nanometers, option C, 1000 to 10,000 nanometers, option D, 0.01 to 10 nanometers. The correct option is option D, 0.01 to 10 nanometers. The quality of Röntgen rays is mainly affected by all of the following factors except option A, material density, option B, patient age, option C, tube potential, option D, wavelength. The correct option is option B, patient age. Which of the following organs mainly regulates the body's cardiac rhythm? Option A, thymus gland, option B, pineal gland, option C, adrenal cortex, option D, adrenal medulla. The correct option is option B, pineal gland. All of the following are the changes caused by the stimulation of the sympathetic nervous system except option A, increased heart rate, option B, fastened digestion, option C, vasoconstriction, option D, increased breathing rate. The correct option is option B, fastened digestion. Which of the following is a fluid-filled, spiral-shaped cavity found in inner eye? Option A, cochlea, option B, pinna, option C, retina, option D, sclera. The correct option is option A, cochlea. Which electrodes of the 12-lead ECG will be placed in the fifth intercostal space left mid-axillary line? Option A, V5, option B, V6, option C, V3, option D, V4. The correct option is option B, V6. Voltage is also known as option A, potential difference, option B, atomic radiation, option C, magnetic radiation, option D, light intensity flow. The correct option is option A, potential difference. The retrocardiac mass, often with an air fluid level, is the feature of option A, ventral hernia, option B, hiatal hernia, option C, femoral hernia, option D, inguinal hernia. The correct option is option B, hiatal hernia. What is the standard unit used to measure sound intensity? Option A, becquerel, option B, decibel, option C, curie, option D, Röntgen. The correct option is option B, decibel. Radium series starts with option A, lead 206, option B, radon 222, option C, thorium 230, option D, uranium 238. The correct option is option D, uranium 238. The yard is a unit used to measure which of the following parameters? Option A, distance, option B, voltage, option C, speed, option D, resistance. The correct option is option A, distance. Which square shift muscle is the main muscle causing pronation of the hand? Option A, pronator teres, option B, flexor carpi ulnaris, Option C. Flexor carpi radialis. Option D. Pronation quadratus. The correct option is option D. Pronator quadratus. What is the atomic weight of radium? Option A. 416.025 atomic mass units. Option B. 302.025 atomic mass units. Option C. 226.025 atomic mass unit. Option D. 106.025 atomic mass units. The correct option is option C. 226.025 atomic mass units. What is the movement of the foot in a downward motion away from the body known as? Option A. Inversion. Option B. Plantar flexion. Option C. dorsiflexion. Option D. Eversion. The correct option is option B. Plantar flexion. Which cell organelle is responsible for breaking down various biological materials including cellular waste and debris and even the cell itself during apoptosis? Option A. Golgi aperture. Option B. Mitochondria. Option C. Lysosome. Option D. Ribosome. The correct option is option C. Lysosome. Which of the following blood vessels is formed by the junction of the right and left brachiocephalic veins which drain the head, neck and upper limb? Option A. Carotid arteries. Option B. Inferior vena cava. Option C. Superior vena cava. Option D. Coronary artery. The correct option is option C. Superior vena cava. A barium mill study shows that a characteristic bird pig or rat tail appearance is often observed at the esophagogastric junctions. What is the probable diagnosis? Option A. Atrial septal defect. Option B. Ventricular septal defect. Option C. Achalasia cardia. Option D. Gastroischemium. The correct option is option C. Achalasia cardia. Which of the following cell organelles is mainly responsible for the majority of the cell's energy production through cellular respiration? Option A. Golgi aperture. Option B. Lysosome. Option C. Mitochondria. Option D. Ribosome. The correct option is option C. Mitochondria. Which of the following structures cannot be visualized by a barium enema? Option A. Descending colon. Option B. Esophagus. Option C. Sigmoid colon. Option D. Rectum. The correct option is option B. Esophagus. Which of the following is the lateral aperture between the fourth ventricle and the subarachnoid space? Option A. Cerebral aqueduct. Option B. Foramen of Magendie. Option C. Foramen of Monro. Option D. Foramen of Lasca. The correct option is option D. Foramen of Lasca. All of the following are units of measuring radioactivity except option A. Sievert, option B. Gray, option C. Becquerel, option D. Candela. The correct option is option D. Candela. The most common surgical procedure to repair a hiatal hernia is option A. Nissen fundoplication, option B. Dermal surgery, option C. Fontanelle procedure, option D. Rumstein pylorectomy. The correct option is option A. Nissen fundoplication. Which is a radiographic examination that uses barium sulfate as a contrast agent to visualize the esophagus, stomach and small intestine including the ileocecal junction? Option A. Barium laxative. Option B. Barium enema. Option C. Barium mill. Option D. Barium suppository. The correct option is option C. Barium mill. Which of the following is produced commercially for medical and industrial use and the main purpose is to diagnose and treat cancer of the thyroid gland? Option A. Iron 271. Option B. Nitrogen 117. Option C. Helium 87. Option D. Iodine 131. The correct option is option D. Iodine 131. Which of the following occurs when part of the stomach protrudes through an opening in the diaphragm into the chest cavity? Option A. Interstitial. Option B. Volvulus. Option C. Hirschsprung disease. Option D. Hiatal hernia. The correct option is option D, hiatal hernia. Which pathway specifically carries visual information from the retina via the lateral geniculate nucleus to the primary visual cortex? Option A, motor radiation. Option B, somatosensory radiation. Option C, optic radiation. Option D, auditory radiation. The correct option is option C, optic radiation. How many lobes does the right and left lung have? Option A, right lung 2 and left lung 2 lobes. Option B, right lung 3 and left lung 3 lobes. Option C, right lung 3 and left lung 2 lobes. Option D, right lung 2 and left lung 3 lobes. The correct option is option C, right lung 3 and left lung 2 lobes. Which of the following organs functions as a crucial link between the nervous and endocrine system? Option A, medulla oblongata. Option B, aqueduct sylvis. Option C, hypothalamus. Option D, corpus callosum. The correct option is option C, hypothalamus. Which of the following broadband area is associated with the primary motor cortex? Option A, broadband area 51. Option B, broadband area 30. Option C, broadband area 4. Option D, broadband area 42. The correct option is option C, broadband area 4. The half-life of radioactive cobalt-60 is option A, 1.24 years. Option B, 2.32 years. Option C, 5.27 years. Option D, 3.11 year. The correct option is option C, 5.27 years. Thank you for watching. Please like and subscribe.